So becoming a pediatric dentist resident is easy. I mean, it's hard to get in first, right? But the hardest part is now that you're a resident and surviving the residency. Tell us, what's been the hardest part for you in being a pediatric dentistry resident?
Yeah, so I'll be speaking specifically about my program and how it's all started. So initially, our program within NYU at the Tampa site, and it's considered one of the busiest locations among all the NYU pediatric dental residency program. So we started back on July 1st, and then right away, like you have to learn and get accredited for the few sites. So it will be a community health center clinic, which is located in Brandon, and they have their own system that you have to learn, and we use our specific program software that we use within the clinic. Then you have to learn the one is from NYU, and also we worked initially with the 3 hospitals, which was Tampa General Hospital, Brandon Regional, and South Florida Baptist Hospital. So every single hospital, they have their own system, and you have to be extremely proactive, learn it really fast, because you're starting being on call and you have to know and navigate the system, you have to make the notes, you have to submit the codes. And I think it was on the top being in the clinic and seeing the patients full time. So for me, that was the most challenging part initially, to quickly learn the system, to kind of quickly establish myself and know how to be very, very proactive, 7 till 5. So I don't carry anything home after the 5. So for me, that was my biggest challenge, how to be multitasking, how to do. On top of that, you start right away literature review, lectures, you do your research, and this is all the time. So for me, it was also like very challenging to find the time, like to see the patients. And I know, okay, I have right now like 10 minutes. So I'll quickly pull the article and I'll quickly like do my review. And it's just like multitasking. That was number one challenging thing that probably took me like about a month and a half. And now it's like the second nature. So I quickly know, like, okay, the beginning of the month, I have to do this and this and this and this, because it's going to be multiple tasks on the top, like seeing the patients or doing your lit review. I think right now, the most and still challenging thing for me, which will be with me until the end of the residency, is being on call. We are on call every 5th week, and we are paired up with the second years. So what is it being on call? You're 7 days on call. So during the clinic, like you start your day at 6, if it's like an OR day, if it's like a typical clinic day, you start at 7, and then you until like 5 o'clock. And then 5 until 7 next day, you're on call. And if you get a call with a trauma at 2 a.m., like, or at 12 a.m., you have to go in. And sometimes you spend the night in a hospital, and then you just like change your scrubs and you go back to the clinic and you see the patients. And obviously, sometimes we can get 2-3 calls throughout the week. And it can be hard and challenging for me, because with the lack of sleep, it's at the end of the week, even the next day, it's like hitting you. And this is like, I think like that's the challenge that is going to stay with me throughout, how to manage that.
Yeah, so it sounds like the hardest part for you in being a pediatric dentistry resident is learning the institution's systems
Right.
and learning it quickly, but also participating as a doctor who is now on call and getting adjusted to being on call as well. Okay,
Yes.
got it. One. Being a pediatric dentistry resident has its perks, has its advantages, but it also has its challenges. And one of the challenges is making sure that now that you're in, that you're able to survive the 2 or the 3 years of your residency training. Stay tuned as we talk to a doc who's just finished her first PGY 1 year, first year of pedo residency, and she's going to share with us how she did it and give some tips, some strategies, and just an overview of her program that she's at right now. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin. Oh, I'm sorry. Well, that's where we are. Let's go back to that again. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, surviving residency, and then life as a new dentist. Guys, be sure that you are continuing to support the channel. You can do that in many different ways. You can support us by sharing this content to your colleagues or people that you know that you think may be interested and that it can help them. Also, you can put comments down below. You can join, and you can also support the channel through Cash App, merchandise. All of the proceeds will actually go to oral health scholarships that we have. Also, today's episode is being brought to you by getintodentalresidency.com. Right down here, getintodentalresidency.com, the ultimate resource to help you get prepared and get into residency this cycle with application prep, interview prep, follow-up, and all the things that you need to be successful to get into residency this cycle. For more details, go to the link down here below. So today we are joined by a previous guest who's recently post-matched into pedo around this time last year, and she's here to share about her journey as a current pediatric dentistry resident. Today we're joined with Dr. Yulia. How you doing?
I'm doing really well, and I'm so happy to be here, Dr. Darwin.
Yeah, good to see you. Good to see you. You look different. You look like a pediatric dentistry resident here.
Really?
Like a pediatric dentist. Yes. Definitely. So please reintroduce yourself to people who may have watched a couple of episodes before and listened to you and when you shared your journey about a year ago, and also for those that are meeting you for the first time.
Yeah, so hi everybody, my name is Dr. Yulia Eve. I graduated from dental school, Midwestern University in Arizona. After graduation, I practiced for 5 years general dentistry, and last year I got post-matched to a wonderful, amazing program in NYU-Tampa side. So I officially finished my first year, yay, and I'm starting second year, which I'm really excited about. And yes, I'm here to share whatever it is, and then we'll leave out my contact information, if you'll have any questions. Yes.
Yeah. Well, people definitely will have some questions, and I have some questions. And the first question is pedo. Why pedo? Why did you decide to become a board certified pediatric dentist?
Okay, so I worked as a general dentist, right? So I was first being able to work with the kids, and just working with the kids, for me, how I felt at the end of the day was so much fun. But now, being in pediatric dentistry, I see different side of it, and it's more deep side of it. So first of all, starting with education, you have an opportunity to meet that 6 months old, with the first tooth and the parent, and you're just giving all this beautiful education each time you see them, how to take a proper oral hygiene, about the diet. And believe it or not, parents sometimes they are so young, they don't know, and they're fascinating, wow, that will make a difference. Then with the pediatric dentistry, it's a really fast pace. So you don't sit with the one procedure, you're kind of doing this and this and this and this and this and this throughout the day. And then you see recalls and typical shorter appointment, which really works for me because I'm very fast, and I absolutely love when my day is very packed and you see one patient, another patient, and see the families and the siblings, and then just also happy, you're giving the toys, you're giving the stickers, all the psychology approaches, how to manage the kids. Plus, as a pediatric dentist, you will never get bored. You have your typical restorative procedures, which includes whatever it is. You can do the surgical extractions, you can do mucocil removal, which is also a surgical procedure, tongue tie, lip tie. You can incorporate ortho, especially if you take the courses right now, a bunch of trillions and zillions of C courses where you can do the ortho phase 1, and it is very, very essential for the pediatric dentist to have some knowledge of that. Also, like you can incorporate oral sedation and of course the general anesthesia. And I think all of this together, it's such like a nice bouquet where you never get bored because you can do one day this, another day this, and another one this. So that's why pediatric dentistry for me. Yeah.
Awesome. Awesome. Yeah. Some great points about why pedo. Thanks for sharing that. Now we want to hear a little bit more about your program. And we know that you're down in Florida, so big move from Boston
Yeah.
to Florida, and you're down in Tampa. So we want to look, we got some questions about the program. We want to highlight your program that you're currently at
Mhm.
NYU Tampa location. So I have a couple questions. So what's a typical week like in
Okay.
your program?
Okay, so first of all, the program is amazing. Like hands down, I think it's like the top of the top. It's not only the top in NYU, but among the PEDO programs. Because if you really want to be very well prepared when you graduate, that's the best program forever, ever. So the typical week, if it's a typical day in the clinic, we start at 7 o'clock in the morning, but we typically arrive early, like 6:45, and then the day ends by 5 o'clock. So typically we see one column of the treatment and two columns of recall. Sometimes it can be 3 or 4 columns of recall. So on average, you see 3 to 5 patients in an hour. You do have your own personal assistant, which is very amazing. If it is an OR day, then you go by yourself to OR day, and it starts early, like at 5:45. And then when you're gonna end up, you see 3 patients, and the attending is working one-on-one with you, and you do have 2 dental assistants and the surgical tech. So it is why I emphasize that, because it's a very essential skill to learn how to be really, really fast. And you have all that team that does all the work for you. So you focus on the dentistry and obviously like on the notes and like preparation of the patient. We also do oral sedations. And oral sedations, it's only in the morning, half a day. So we do see the 2 patients. One patient started at 7:30, another one is 9:30. And we do run the oral sedations every day, but typically each resident have like one day a week or once in 2 weeks of oral sedation. So again, like if it will take like 5 days, typically it can be 3 days of the clinic, 1 OR and 1 sedation, and then you see the patients in the afternoon. Also, if you're on call, then you're taking the whole week on call. It's after 5 until 7 every morning, and you get the call from any hospital, like Tampa General, South Florida. If it is whatever it is, like you have to go into the hospital and do the emergency treatment for the patient, and of course follow up. Yes.
That is a very, very busy day and week. And that doesn't even include your didactics and other things that you're doing as far as journal club and maybe some research projects. And
Right.
that leads me to my next question about research. What type of research or what's typically done there at your program? What's required?
Yeah, you're required to complete the project to the post and present it at the APT or any other professional meeting. So I joined the group, which is from NYU Langone, and we have 3 residents that work on the same project. It's on the salivary protein and the caries level. So right now we actually already finished up the manuscript, and we start working on the poster and the abstract. Yeah.
Now, is the program at Tampa, is it one of those programs where um, there's a strong emphasis on research, meaning they are encouraging residents to be published above and beyond what's required for the residency, or is it just pretty much just the residency requirement that they're focused on?
Yes, this is the residency requirement. No one is pushing you. You're just required to complete the research project, and that's how it is. Yeah.
Now
But
you
then
mentioned, oh, go ahead.
they're not big on research. They're very big on the clinical. And regarding the didactics and the lectures and all that stuff, we do have it almost every day at 7 o'clock, 7 to 8. In the first year, every Thursday afternoon, we do have lectures from Langon. And plus, we have a lot of different courses online that we have to go on our own time.
So you've got online classes and
As
courses
well, yes.
that as well as that are part of the curriculum, both in person during the day, but also in the evenings as well.
Yeah.
Right. Gotcha.
Yeah.
Based on that, what have you found that you like or love the most? Not only about being a pediatric dentistry resident, but also being a resident at the program that you like. What are some of those things that you like and love the most?
Oh my gosh, I love like all of it. Like I cannot say anything about it because it's such like fast pace. So I will say from the very first hand, I worked as a general dentist and I know what is it to transition from the dental school to go and see the patients in a private practice. And it can be very challenging. So now being a pediatric dentist, I take every single advantage to learn to do more, to be how one of my attendings said in the beginning, learn how to be comfortable with being uncomfortable. And this is the part of the program that I absolutely love, that we are super busy. We see a lot of patients. We see a lot of trauma on call. We do a lot of oral sedation. We do like a lot of general anesthesia cases. And give me more. And specifically about this side, if I feel something I'm uncomfortable with, and it creates like fear in me, I wouldn't like stop and try to avoid. And this is advice for everybody. Do not just say out loud, I'm not comfortable with this procedure and I want this procedure, and go through this like being uncomfortable. 1, 2, 3, and 4, and then you will ace it and you will breathe out and it's going to be like a second nature for you. So that's like my goal. So if I see something that I really want to do that I didn't expose to, for instance, mucocil excision, right? So I did one, and then I was like, okay, I have a challenging kid. Can I do it like under oral sedation? So we just like did the case under oral sedation to excise the mucocil. And like it's just like this program, like you can do whatever you want, how you want, and you get tons of experience, which is amazing. Amazing.
Well, that's good. With that same momentum, what are you looking forward to? What aspects of the program are you looking forward to the second and final year?
What I absolutely love. So when we started the first year, we have a specific cases, presentations, it's didactics, then the lit review, and then we also have constant like different presentations. So during the second year, we'll have and we basically went through the reference manual from APD and the little book. So we covered each topic. So it was the first time for me doing that. But now during the second year, our first class is coming and we're going to go all over all this information again. And I'm looking forward for that because now when I have knowledge, it's more not just like read and get yourself introduced, but now it is the interest when you can apply the clinical into the didactics and kind of like just lock it into like your mind and your abilities to practice. And for the second year, I definitely look for get more speedy, more difficult cases, especially like managing special need kids, because we do see a lot of them. And even like last time when I went to OR last week, like my faculty asked me, what do we want to work on today? And I was like, speed, like whatever it is, like teach me, like show me like how can I use my time. So for instance, while assisting is giving me one instrument or they're mixing the cement, I can quickly change the burrs, or I can quickly like use the periosteel to do the next extraction before like cement in the ground. So like all this like matters. And when you go into the world, every minute will be count. Like you might be ending up like saving the time and have an extra kid that you can help out at the end of the day just because you're so efficient.
Yeah, the efficiency is very important, especially when you're doing these cases in the OR and you have limited OR time that's granted to different disciplines as well.
Yes.
And that could be a challenge, learning to, to increase your speed, still be efficient, work as a team, and get everything that you need to get done so that you can keep delivering oral health care. What so far about the program has been something that's been hard for you as a first year? What specifically, one or two things that's been a challenging part about the program?
So as I said initially, it was for me to learn the systems because we use different institutions, and the time when I started it was 5. So each on every single one of them, they have their own software program, and like you have to be efficient. Last Monday, for instance, in 1 hour, I saw 8 patients, so you have to do like 8 notes. Like you need to do referrals. Sometimes you have to get into that quickly and do like the prescriptions, and you need to know the system. You don't have those like 10 minutes to sit down and think like, oh my gosh, how can they prescribe, right? Or at 2 a.m. in the morning when the Tampa General is calling you, like, and you have to place like the orders in or whatever it is. Like you don't have time like at 2 a.m. doing all of that. So for me, that was the biggest challenge, and that was my task. What I wanted to do, learn it really fast so I can be again like very efficient, because the residency is busy. It's just like how like fast you are and how efficient you are. You can have like one night call and just do it like for like 3 hours, so you can do it like in 1 hour if you're very efficient, you know what you do. So yeah, that's like was my biggest challenge. And then it's just like very like I'm exciting like every day, like when you
Yeah,
come, it's like you're
yeah,
learning. It's like another case, another case. Yeah.
yeah. Well, I that sounds about right, because anytime things that's new and you're learning a new skill set, learning a new system at a new institution, you're learning a new way of doing treatment with different support systems. All of that's going to be a challenge starting out.
Mm-hmm.
But it's also part of the process, right? It's part of the process of you being board eligible, and also leading to being board certified as an expert, right? That's
Mm-hmm.
part of the process of being an expert. So to be a pediatric to be a board certified pediatric dentist, you got to get into pedo, and before you get into pedo, you've got to apply. When you apply to pedo, you also have to understand what are some of the things that make a candidate make the candidate ideal for the residency. So based on your experiences, based on your process of and journey to getting to where you are now, as a pediatric dentist residence in training, what would you say are some of the ideal characteristics, or what makes uh, a candidate ideal for pedo training? What makes an ideal candidate for pedo training?
Mm-hmm. So they definitely want to see someone who comes and who is ready to work 100%. Give it 100%. Be excited to work. They don't like to see when the people complain, when the people are cutting the corners. And believe me or not, there are ways to cut the corners, and we do not want to see that in our profession. Listen, you are working with the kids, you are granted the position at the residency, which is like very huge privilege. Like you want to be very true, devoted, confident, and do the work. You need to be a team player. If you finish up the day and you see like your dental assistants are still like cleaning, or like your residents are still like doing the work, you can jump in, you can do the help. In my program, we're very big on that, especially like if it's like sedation or whatever it is. We just help each other out, like quickly submit the codes, do even the notes. We help each other a lot, and that's what makes us very efficient as a team, and we deliver the best care. And I think the other thing that we want to see from incoming like residents and the faculty as well, being proactive. So like if you face the challenge or there is a question, you don't go and you don't bother people with this question. First of all, like you open up the internet, Google APD manual or the APD little book, and you try to find the answer. And it really works. So like if and even after that, like you have a question, then you at least like can bring to the table, like, listen, this is what I've done, this is my research, but I still have a question. Can you please like navigate me? But try to find the answer to your question first, because we are all busy, we are all overwhelmed, and we respect the people who do the work, and be very eager to search for the answers. Yeah.
Awesome. So being confident, being a team player, a person who understands the importance of working together, collaboratively, and also collectively, and helping each other, and being proactive, right? Being proactive, not shy away from waiting until someone tells you or instructs you to do something, but you're taking the initiative first and foremost, and then maybe following up and asking for help and things like that.
Yes.
Absolutely. Absolutely. So that leads me to a question that everyone really likes to hear about, which is tips and advice, right? Knowing what you know and where you are currently going into your last year of your residency, what are some tips, tips and advice, number one, for individuals applying to PEDO right now? And then also be interested in hearing some tips for those that are getting ready to start their PEDO residency, or will be getting ready to start their PEDO residency very soon. So first, tips for candidates that are applying to PEDO.
So the first for the candidates. Okay, so first of all, like you truly need to understand like why you go into the PEDO. Not because it's prestige, not because it's like what someone recommended you. You need to feel it. So go shadow the pediatric offices, because being a pediatric dentist can be very, very hectic, stressful, and busy. Like you need to know how it works internally prior you apply. Then you need to know your goals at the end of the residency. What do you want to do? Like, do you want to be like a very high value practitioner? Then probably I would suggest to choose hospital-based programs, because they are very, very busy on clinical skills. But if you like looking forward to go more into the teaching institution or research, then I would suggest to choose university-based program, because they're very heavy on didactic and research, and this is also wonderful, and we always need that in our profession. Yeah.
And then as it relates to individuals who just got into PEDO and are getting ready to start, what are some tips for them as they're transitioning? Many coming from are recent grads that are coming from dental school right out of school. Some are coming from residency programs. Maybe they did a year or two at GPR or AGD, or like yourself, individuals who have been working several years as a GP dentist. What advice would you give them now that they are now transitioning into the residency as a first year PEDO resident?
Yeah, learn how to be comfortable with being uncomfortable. That's the advice that I got when I started, and this is very true, because everything will be new and you will be very uncomfortable in every single state, like how you run the procedures, how you run the clinic, correlation with the new co-residents, with the faculty, you will be uncomfortable. So just learn this skill and be comfortable with being uncomfortable, accept everything, respect, professional respect to every attending, to every co-resident, be a team player, and jump in. Don't wait for anybody to ask you for help. Jump in, and please expose yourself and do as much as you can during the residency. I know there will be the days when you are so exhausted and you just sit down in the chair, but there is an opportunity for you to learn. If someone, your co-resident, does like a pretty cool case, just go and shadow it. Just do it. Try to assist and do as much as you can. Remember, it's only 2 years. They will pass very fast. You will have your time and your breaks and vacations and afterwards, but gain as much as you can, because when you will graduate, there will be no one to refer to. People and general dentists will refer to you. You will be like the end of the tunnel, and you will need to do all the procedures and manage that. So gaining all that experience will make you more comfortable and more peaceful at the end when you graduate.
There you go. 4 great tips for incoming pediatric dentistry residents. Be comfortable by with the fact that you're going to be uncomfortable, right? That's part of the process. Make sure that you maintain and give the highest respect, professional respect to your colleagues, both your co-residents, staff members, and the faculty. Be a team player, team person. Make sure that you're inserting yourself as a team member. And last but not least, for those incoming pedo residents, is make sure that you are increasing your level of exposure to everything that the program has to offer, even if it's, again, uncomfortable, even if it's not something that you think you would be interested in. Just give yourself the opportunity to be exposed to it, because you are in an environment where you're supposed to be learning, and not all learning is fun, right? There are some things that you're not going to feel like you need to learn or think you want to learn, but it's part of the process. It's part of the process, and it's why you are considered, or will be considered at the end of your residency training, board certified, but also considered the expert. The expert. All right. So to be the expert, you have to expect doing things that you don't want to do to become and be the expert. Doc, what's the best way for people to get in contact with you if they have any questions or just want to connect with you overall?
Yeah, so it will be my email, and I would give it. It's Y as a yellow, U as umbrella, L as a lemon, I as an island, A as an apple, E as an Edward, D as a Victor, E as an Edward, D as a David, M as a mom, D as a David @gmail.com.
There you go, right there. It's right there. Thanks so much. So reach out to her. As you guys can see, serious professional inquiries only, because Dr. Yulia is busy. I think being down in Tampa and being a resident, you have increased your level of communication, and you have talked very fast today, because that's the pace. That's the pace of the program. That's something that you're learning, to be able to direct, coordinate, collaborate, move around really quickly, but at the same time be very efficient. A little bit something different that I've noticed since being a pedo resident. Again, all part of the process. Part of the process. What are you planning on doing after residency this time next year when you finish up? What are some of your future plans that you can share?
I would definitely practice in a private practice initially. I don't know yet the location, but I'm open, and closer there, I will determine the location, but it will be definitely a private practice.
Awesome. And I think that's one of the points that you made related to knowing your reason why and what type of practitioner and how you want to practice and deliver your expertise as a board certified pediatric dentist. Do you want to be in clinic, more of a clinical emphasis, or do you want to have an academic emphasis? And choosing the program based on that will be key, because it's going to be the next step, or the foundation for your next step after residency. Well, this has been very helpful, talking about your journey through residency and surviving residency and continuing to move forward. Definitely want to follow up with you around this time next year as you're completing residency, which also means preparing for the board certification for pediatric dentistry. And this has been great. Thank you so much. And guys and gals, what also is going to be great is if you go to the next video. Something's great right next to the next video. Go to the next video right now.